All right, once again, thank you for joining this COVID-19 Leaders Forum. We have a great group here this evening, folks, to talk about the impact of coronavirus at multiple layers of government and then obviously in communities as well. And we're joined tonight by U.S. Senator Bob Casey, Pennsylvania Senior Senator, who is with us. We're also joined by the Reverend Sylvia King, who is a member of Johnstown City Council. Also on the panel, Jim Rigby, State Rep from the 71st District, which includes Johnstown. Also, Martynuska, Cambria County Emergency Management Agency Coordinator, and Pamela Tokar-Ickes, a Somerset County Commissioner, among her many roles of service in our region. So a great panel tonight. Again, this series is sponsored by This Together Cambria and the University of Pittsburgh at Johnstown. My name is Chip Minnemeyer. I'm the editor of the Tribune-Democrat, also a sponsor. And I believe this evening we're going to let Senator Casey start us off by talking about the bill that's the American Rescue Plan and where that stands and his thoughts on what that'll do for our country. Senator?
Well, Chip, thanks very much. I want to keep within my time, so I'll try to make this 10 minutes. Is that okay?
As long as you like.
Okay. I appreciate that. I usually don't get that invitation. I'm grateful. But Chip, thank you. And I want to thank the Tribune-Democrat as well as UPJ, University of Pittsburgh, Johnstown, and also in This Together Cambria, the elected officials who are with us tonight. Just wanted to provide a brief summary, and it's probably going to be all too brief, about the legislation just passed on Saturday, the American Rescue Plan. But I think if I had to boil it down to three words, those three words would be vaccination, schools, and people. And obviously there's a lot behind each of those words, but we want to make sure that we can take the steps that are necessary to put the virus behind us. And that means a lot more vaccinations. We're fortunately growing. That number nationally has been growing for the last several months. We're, I guess, right around maybe 2 million vaccinations a day nationwide. But I hope, this is just my own view of this, I hope we can get that number to 3 million a day or above. That's when you can really accelerate the numbers. But because of vaccines, there's obviously hope on the horizon after this terribly dark year. I was just looking at the numbers today. You know the number of deaths nationwide, more than 527,000 as of today. I was looking at the Pennsylvania numbers. Pennsylvania right now has, and I think this is the most current or close to it, 24,396 people who have died, and we're above 950,000 cases. So probably by the end of this, we'll be well above 1 million cases just in our state. So we're still in the midst of the pandemic, but the vaccine, of course, is a light at the end of a long, dark tunnel, but we're not there yet. So we've got to, as much as we're pushing the vaccine as fast as possible, we've got to make sure that we're still following the public health guidance to make sure that we're keeping everybody safe. But I think some of the dollars in this bill that go to vaccinations are going to be critical. There's tens of billions of dollars just for that. When you get to schools, the last number I saw in schools is about $130 million, $1 billion, that's with a B. And we want to make sure that schools open safely. And that, of course, costs money. We can't just, you can't have politicians like me preaching at school districts and states to open and not give them the funding they need to safely reopen. So the $130 billion in this bill for K through 12 education will respond to students' needs to implement the necessary public health protocols for safe reopening. So that's going to be critical to have those dollars available so that you can have the kind of ventilation that you need in a school, or making sure you're reducing class sizes for social distancing. A lot of schools still need PPE, personal protective equipment, and obviously hiring additional staff. So there's a lot there that is essential. Also, one of the areas that I worked on very aggressively was to make sure that we're getting more dollars for home and community-based services, not only because of the vaccine, not only because we're in the midst of the virus, not only because we're in the midst of the pandemic itself, but even absent this pandemic, we need more dollars for home and community-based services. But the pandemic puts a real spotlight on it because we've had across the nation over 174,000 people across the nation who died in a nursing home. When you add up the number of deaths among residents of nursing homes with the workers in nursing homes. One of the reasons for that number being so high is you had a lot of people in congregate settings. So if we have seniors and people with disabilities who want to get the care that they receive in a home setting or a community-based setting, we got to have more options for them. And unfortunately, the options have been limited, and therefore the waiting list for those services is at last count of 800,000 people nationwide. I think that number is an old number. It's probably a lot higher than that now. People with disabilities and seniors waiting for those services and can't get them because they didn't have the funding. So we provided new funding for this, $12.7 billion for home and community-based services for seniors. It's especially important in the pandemic, but it would be important even if we didn't have the pandemic. When you look at the overall funding for Pennsylvania, the best estimate I've seen recently is that the bill overall will provide the state about $13 billion for Pennsylvania, and that would include funding for the state, programs that impact people in the state, and of course, funding for local government. There is a separate allocation of dollars for local governments and for county governments. So for example, we're told that Johnstown could get as much as $30 million. Don't hold me to that exact number today, but that's what we're told is the estimate. And that Cambria County overall could get a similar number, somewhere in the neighborhood of $25 million. So these are dollars that are needed at the local level, needed at the state level to make sure that we don't add to the job loss, the terrible job loss we've already had. We don't want to add to that by having layoffs of firefighters or public safety officials or teachers. And we've already had some of that, especially the layoffs of a lot of teachers. So we also tried to focus in this bill on seniors beyond just the home and community-based services to make sure that we're accelerating vaccinations among seniors. We know that the long-term care population, those numbers have increased dramatically in most communities throughout the state. Those in long-term care settings have had an opportunity to get vaccinated or we're getting to that. But there's still a lot of seniors who are not in those settings that we need to make sure that we have dollars for. So there's about $60 million just for Pennsylvania. This isn't a national number, just for Pennsylvania, to help aging service providers connect seniors to vaccination appointments and to support services like home delivered meals and respite for family caregivers. So we have obviously more to do to make sure that we not only have the bill passed, but we get the bill implemented, get the funding to communities and get the checks out. We know that the $1,400 checks that are provided should be out by the end of this month, and that's going to help a lot of families. I think the provisions in this bill that help children, many of whom have been terribly adversely affected by this pandemic, not only because they're out of school, but because their families have had trouble paying for food. We have, by one estimate, 50 million Americans, including 1 out of every 4 children, who are hungry. So the food assistance in this bill is essential, but also the provisions that directly affect the life of a child and the life of their families. The bill itself, according to Columbia University, will reduce child poverty by 50%, by half, just as one bill, because of the provisions in the bill, the $1,400 check, the unemployment insurance help, the child tax credit enhancement in this bill, a provision that I worked on specifically and have been trying for years to get this done, got it done finally in this bill, is a substantial expansion of the child and dependent care tax credit, not the child tax credit, the child and dependent care tax credit known by the shorthand, the child care credit, to help families pay for child care, which is so essential not only to the life of that family and the early care and learning of that child, but is essential for economic recovery. You can't have an economic recovery if parents can't get back to work, especially women in the workforce. And speaking of a group of Americans who have been devastated by this pandemic, in the United States of America, in the month of December alone, every job lost in America was lost by a woman. Every single job, 156,000 women lost a job in the month of December nationwide. Men gained 16,000 jobs. So women have been hardest hit. Their workforce participation rate right now is the lowest it's been in a third of a century, 1987. That's how long ago the labor force participation rate among women was that low. So we've got to continue to focus our efforts on making sure that the American family gets a lift. You know, there was a chart that was displayed today that compared this bill to the tax bill of 2017 in terms of the impact it had on the rich versus the poor and folks in the middle. And I think you know the disparity there. The tax bill of 2017 was for the rich. More than 80% of the benefits of that bill over the life of the bill go to people in the top 1%. 80% of the tax benefits. Not to mention the huge giveaway to big corporations, permanent tax relief for corporations. This bill is the opposite. It goes to folks in the middle, and it goes to lower income folks who almost never get much help from Washington. So I'd say to the people of Johnstown and Cambria County in southwestern and south central Pennsylvania, throughout the whole region, from Johnstown north and from Johnstown further west into southwestern Pennsylvania, this bill is meant to meet the moment, not just to take this virus and knock it down, punch it down, but also to lift up families who have been getting the short end of the stick in Washington for too long. And it's about time both parties came together to try to lift up these families. So we've got a lot more to do, but we want to make sure that folks have at least some sense of what we have legislated. And the people of Johnstown and Cambria County have worked long and hard for their communities and for their country. And we want to make sure that this bill lifts up the people of the county and neighboring counties. I know that we have Somerset County represented here by Pam and others, and other counties in the region. But we want to make sure that we have a bill that's implemented as expeditiously as possible to lift people up and to move into the future together, so we can put the virus behind us, open up schools, and lift up these families so we can have a full economic recovery. So thank you, and I'm grateful for the opportunity to be with you tonight.
Senator, while we still have you, what are you hearing from the House? Where's the bill right now, and when can we expect something to move on the other side of Congress?
Well, Chip, far be it from a senator to predict exactly when the House will take action, because I'm not certain. But I hope if it isn't tonight, probably tomorrow, and then I hope the bill can get to the president by Wednesday. So maybe by the end of the day, Wednesday, we can have a bill that is enacted, and it's not enacted till he signs it. But then his team has to go to work, and we're going to push them hard to get this relief out there so that we can have the benefit of it.
The president said we would have people vaccinated by summertime. Is this bill going to help us move in that direction? You were talking about maybe 3 million a day at some point.
Well, I sure hope we can get to that. That would be my goal. But the administration, I think, has a good chance now of exceeding their 100 million vaccinations in 100 days. I think the number I saw yesterday we're just above 90 million with at least one dose, and then tens of millions on top of that have had, maybe it might be about a third of that, about 30 million who've had 2 doses. But However fast it moves, it probably won't be fast enough because so many people have been waiting for too long. But I want to just get the right number for the vaccinations. Here's how it breaks down. 50 billion for testing, genomic sequencing of the variants. The way you stay ahead of the variants is keep an eye on the variants by doing genomic sequencing, and contact tracing efforts, as well as manufacturing and procurement of PPE. So that's 50 billion. There's another 20 billion for vaccine distribution and administration. There's an additional 10 billion for the Defense Production Act to procure more PPE, because we still need that. And then there's another 8 billion for the public health workforce development. We still need kind of troops on the ground to get as many people vaccinated as possible. So those component parts, you've got about almost 90 billion right there. So it's just, we can't get the job done on vaccinations unless we have that funding.
I think we're going to make the bill available for folks who are watching either on Facebook Live or on our Zoom so that they can go and read it for themselves. We appreciate your office sending that to us. Senator, before we let you go, the rest of the panel was folks at the state, county, and municipal levels, and everything you do obviously has an effect on what they. Yeah, can you talk a little bit about that relationship and how important it is?
Well, it's vital, and one of the reasons I mentioned earlier the funding for Johnstown and Cambria County is because there are an awful lot of communities across the state and across the country that have had trouble because of the virus. Because when a pandemic hits, it's like a natural disaster on steroids. And I don't have to tell people in Johnstown what a natural disaster is like. You've had too many of them. But when that hits the country and you get a hole blown in your budget and you're trying to balance a budget in a city like Johnstown or a county or any level of government, the only show in town that can help, so to speak, is the federal government. And that's the way it should be. Corporations can't help. There are sometimes the private sector wasn't able to help either. So the federal government, and yes, we run up debt when we do that, but that's one of the things you have to do. If you want to get the economy out of the ditch, you've got to spend money to do that, to help struggling communities, help struggling families. And the linchpin, of course, is vaccinations and doing everything we got to do to deal with the virus. But I want to make sure I don't forget, 65 billion of this bill is for municipalities, another 65 billion to technically 65.1 billion for counties. So there's 65 for local government, another 65 for counties, and that's billion. And then the states are sharing 195 billion. One of the complaints we got in the CARES Act was that the help for the states was great, but the states, took a long time to get it down to the local level. So we want the direct funding to go to local communities because when those communities recover, the economy recovers and we're all better off.
And I believe the numbers you said earlier, 30 million more or less for the city of Johnstown and about 25 or a little more for Cambria County. So very good. Thank you for sharing that. Anything else you wanted to talk to us about while we have you on?
No, Shib, I just want to say thank you to you and those on the call and the community. You've had challenges that I know that have been difficult over many years, even more than a couple generations. So you've always been so kind to me when I visit Johnstown and Cambria County in the region, and I look forward to seeing more of you in person when we're able to do that.
Soon. And we appreciate you taking the time to come on. Obviously, there's a lot happening right now at the federal level with the relief bill. So thank you for coming on and breaking it down for us and for the folks watching this forum. Thank you so much, Senator.
Thanks, and God bless your work.
We're going to move now to Johnstown City Council member Sylvia King. Reverend King, you've kind of got a personal story about COVID that you can share with us. You're on oxygen and clearly you're still recovering from your bout with this virus. Thank you so much for joining us and sharing your story.
Thank you for allowing me to be here this evening. You have to forgive me because my nose keeps running. That's a result of having the oxygen. So I just don't want to keep cleaning my nose on the camera. Yes, but truly this was a devastating experience for me because I've never been sick a day in my life. I've never been in the hospital before. Never been on any type of medication. So this certainly was devastating for me because I didn't even realize the severity of my condition until they actually checked me out of the hospital. And then they started going over things with me. You know how when you're being discharged, your medication and whatnot. And they started going over these things with me. And then I said, wait a minute, what is this? And they said, well, you have no idea the shape that you were in when they brought you in here. You were in acute respiratory failure and you were septic. And I'm saying, what? You know, so I finding this out later. And I mean, to lay there in that bed and start being pumped with all these different medications, you know, to thank God that they helped to bring me around. And I couldn't be more grateful to the hospital staff for their care and concern, you know, but here it is now, I'm still dealing with the effects of having COVID. So I want people to know that it's not a joke, nor is it a hoax, you know, because I had seen other people that pop back up after 10 days, after 14 days. So when I found out that I had it, I said, okay, well, I'll be down for a week or so, you know, and then I'll be fine. Well, guess what? That just didn't happen that way for me. But guess what? I'm also not one of the 500,000 who left this world. So God knows I'm very grateful for that. And when I laid there in that bed, and I just truly felt the Spirit speak to me saying, you must now tell your story because perhaps what you have gone through will help someone else. And I'll use my son as an example because he said at first he was not going to get the vaccine. He said, but then after he's seen what it did to me, he couldn't wait to roll up his sleeve to get the vaccine. So I just pray that if there's something that I can say to anyone to say, you don't want to be in this condition. You know, I don't know what all will be a result of me having COVID because there are people now that have life-changing ailments or whatever you want to call them that they did not have before as a result of COVID. And I don't know what's going to be the end result of my having COVID. I got sick the other day. I don't know if that was a result of this or whether it was just, you know, how you just have a bout of something. But nonetheless, if there's something that can avoid you, stop you from getting this disease, I wish I would have been able to get the shot then. Then I would not have had to go through what I'm going through now.
We're very happy you feel up to being with us tonight and, you know, continued recovery. Want to let the audience members know you can ask questions of our panelists here, State Rep Jim Rigby and the county and local officials by posting questions on Facebook Live, if that's where you happen to be watching us, or going into the Q&A function of your Zoom, if you're watching us through Zoom, and posting questions there, and we will try our best to get the questions answered. We have a great crowd on and a nice audience, so we may not get to every question, but we will do our best as we move through this evening's session. Let's go now to State Rep Rigby. Mr. Rigby, you represent the 71st Legislative District, which includes your town of Ferndale, city of Johnstown, and other areas. Can you talk about what is happening in Harrisburg, what you've seen happen? We're a year into this, and kind of what your thoughts are about what state government has been up to in terms of coronavirus.
Sure. Thank you, Chip. And again, thank you to the panel participating and to We're in This Together. Glad to be part of it and give you a little bit of what I know what's going on our end. The legislature recently appropriated nearly $1 billion in federal money to local governments to help those struggling to make ends meet. Also included in that was a $145 million grant from the state funds. We feel that it's important that the legislature has a say in this. We are the closest. Our offices get all the calls. We hear the people's daily needs. This money is going to go to rural counties, businesses, and the people that need it most. This was passed in a bipartisan manner to get relief out quickly. In this budget passed in November, we followed federal guidelines to fund the frontline state government services impacted by the pandemic. And again, short-term solutions need to be combined with long-term planning and strategies. And a vaccine, we feel, is the most important long-term solution to getting back to normal. Now, the vaccine itself certainly has been a major bipartisan concern with the rollout. And look, we can't change what's already been done, but we can put ourselves in a position to do better in the future. We still remain in the bottom fifth in the country in terms of vaccine deployment and efficiencies, but things are looking better. We're participating in a bipartisan bi-camel vaccine task force to improve distribution, getting the National Guard involved in future vaccine distribution infrastructures, getting teachers vaccinated so schools can go open and stay open, and even schools this year to get them up and running and to keep them open. And so as more vaccines become available, I'm confident that we'll have the infrastructure in place to be in line with the national goal of having everyone vaccinated who wants to be within the first half of this year.
Thank you very much. A lot of the push from the state comes down to the counties, and we have a couple of county folks on with us right now. A lot is happening in both Cambria and Somerset counties. Mr. Martynuska, could you talk a little bit about what you're seeing in Cambria County? Is the new task force up and running? A lot of programs in place now and getting rolled out to try to get out to people who might have been isolated or not, you weren't able to get to originally. Can you just take us through the work of your task force and some of the things you've got in motion in Cambria County?
Sure. Thank you for the opportunity. The task force is made up of a multiple variant of groups, both public and private, covering numerous disciplines. We have folks from healthcare, from social services, from county government, from private entities. A lot of support and a lot of great teamwork has come to the table to get this vaccine rollout done. We've been meeting quite regularly. We have a subcommittee for communications that is developing messaging that we can get out to our folks in an effective and efficient manner. We've tied that in to make sure that it's not going to become stale information, to provide provider locations, to provide question and answers for those who may be hesitant on receiving the vaccine. So we've come together and it's gelled very nicely. It's moving forward. Our goals are obviously to get the vaccines out, to get them to a number of people that we can across the county and across the area. To that end, we've gone so far as to engage our emergency service folks on different levels if we need to get the messaging out and use them for staff, if you will, along with students from the various colleges and some of our other social service groups. So it's actually working very well. What we're waiting for, obviously, is the vaccine to hit the door. And when we have a steady supply of that, with that being said, we have over 12,000 people in Cambria County who are already fully vaccinated, with almost 11,000 people who are partially covered. So we do have some vaccines that have been rolled out. If you look at the state has about 981,000 people vaccinated and a little over 1 million people who are partially vaccinated. So we're keeping up with those percentages in Cambria County as far as we can see that across the state. And again, we would, like everybody else, are waiting for a steady supply. One of the things that did help us with this mission is the use of the last CARES funding. That has allowed us to upgrade our communication system as Somerset County did, with a broadband initiative to help us hit some of the areas that were lacking. In addition, we have a new code red alert system that we put in place. Somerset County had put a similar system in place last year, and that allows us to reach out to our population in mass. People can register, or we can send a cold call if we need to alert them of vaccine locations. So far, that Code Red program has met with great success. We unveiled it last Wednesday, and we have well over 10,000 people who have registered for that. And we're certainly encouraging everybody, not just because of the COVID situation, but because of all the other emergency situations that we may have to deal with in Cambria and Somerset County, to register for those programs so we can alert them in a timely manner, almost real time for that matter. We've also been working with a number of our providers throughout the county that do vaccines, Mainline Medical, Conemaugh Hospital. Conemaugh Hospital is going to be doing a mass vaccination program that they opened up registration for yesterday, I believe. That number is going to be posted, I believe, in the gallery for people to see. And those vaccination locations will be coming up mid-March with the second vaccination scheduled for mid-April at the Galleria. I expect to do about 1,000 people a day at those locations. And if, once again, the vaccine becomes more abundant, we'll certainly see more of that. But again, I'll reiterate that people should get the vaccine. It's been vetted, it's been tested. There should be no hesitation, and the response does work. So any questions anybody have, they can contact our offices, and we'll be glad to point them in the right direction if we can't answer the question.
I believe we're sharing that information for how to reach out to you for our audience, so you folks at home can contact both the Cambria Alert and Response and Engagement System, and also Conemaugh Memorial Medical Center if you're interested in those mass vaccinations. I understand, Mr. Martynuska, while we still got you, you're going so far as to door to let people know how to get vaccinated and help educate the community on how we can fight back against the pandemic.
Part of our planning methodology is if we need to get the message out, we're prepared to go door to door with our emergency service partners and our social service partners who are out there and get the message out. We can leave door hangers, we can talk to people directly, and we're also planning to take the vaccination show on the road, if you will. We're working with Camtran on a program to move that forward and take the vaccination to where our citizens reside.
Excellent. Now we're going to move to Pamela Tokar-Ickes, as Somerset County Commissioner, and that really doesn't go far enough, Pam, in talking about the various things you do for our region, from the United Way to Community Foundation and on and on and on. Somerset County has been very involved. Mr. Martynuska mentioned infrastructure and technology. You've been involved with mask production. Can you just talk about what's been happening in Somerset County and where you see this all heading for your residents?
Sure. I would also like to just thank everyone who's on the panel tonight for the time that they're investing. Senator Casey for his work and just for the opportunity to participate. There is a lot going on behind the scenes, as Art outlined. Somerset County is also a part of the growing Cambria-Somerset COVID task force. And we're very pleased to be a part of that growing organization, that growing group. As the distribution ramps up, we're looking to share resources and share ideas whenever we can. We have been here basically in support of all of our vaccine providers since the start, when the vaccine started to roll out. County commissioners in Somerset County have met weekly with our hospital-based vaccine providers and representatives from all of our public school districts. We have 11 of them in Somerset County, and we've been tracking the number of vaccines and the not only the number of vaccines received, but also delivered, the shots in arms, so to speak, here in the county. I'm very pleased to tell you that it does appear to us here at the county level as well that the vaccine supplies seem to be increasing, albeit slowly. I think we are ramping up. Our providers are telling us that they're beginning to ramp up their own community clinics here in Somerset County in both size and frequency. And some of Art's partners are our partners as well. We have the Conemaugh system, the UPMC system at Somerset here, and also Winber. Also, some of the private pharmacies have done a fantastic job. I think just a shout out to Mainline. They have probably put more shots in arms than a lot of folks ever imagined could be possible in such a short period of time. So congratulations to them. I will say that, we certainly, as counties across the Commonwealth have been, it was very clear to us from the outset that the rollout of the vaccine through the Department of Health was going to be through the provider agencies. So not directly county EMA. So therefore we stand ready and have told all of our providers that we are here to assist them with the resources that we have. Across the state, we are linked through our state association, the County Commissioners Association, who's been working directly with the Wolf administration and all of its agencies, including health, emergency management, education, aging, DHS, and really what has been a cross administration effort to get shots in arms. And of course, we are not only working with Cambria County, we're working with our counties across the Southern Alleghenies region, as well as other counties that surrounds that region. That network has proven to be vital to us, whether it be sharing information or sharing resources. The goal for all of us on this panel and for all of our colleagues across the state basically is just to get shots in arms, to get that vaccine that is safe, it is proven, get it out there, get this pandemic behind us so that we can rebuild our economies.
Thank you, Pam. We're starting to get some good questions from our audience, and we're going to use a couple of them right now. Let's start with this one is probably best for Mr. Martynuska. We're seeing cooperation, obviously, between Cambria and Somerset counties on a lot of these programs. Can people from neighboring counties get vaccinated in Cambria County, specifically at the mass vaccination clinic at the Galleria?
The answer to that is yes. There's no boundaries. People can register. They make the appointment just like everybody else, and they can get registered regardless of where they live.
Excellent. Here's a question specifically for Reverend King. How long has it been since you contracted COVID? And this person says, I think it was very important the panel talk about long haulers or people who started out perfectly healthy, as you say you were, because there's so much doubt. She says, thank you for your story, but just kind of how long you've had it and kind of what the journey's been like in that regard.
I'm going to say January the 5th is when I suspected that I, had COVID. Now, and she has to forgive me because my dates and times may be off because one of the results of having COVID is having some brain fog. And I'm experiencing some brain fog. So some of my information might be a little cloudy, but it's been since the 1st of January. That's how long it's been. And that is my point exactly. And I've heard about the long haulers. The people that are still having symptoms 4 and 6 months after having COVID. And I mean, I'm praying, of course, that doesn't happen for me, but nonetheless, I realize that I'm just about there, because this is my 3rd month now and I'm still having symptoms. I will be perfectly honest with you and tell you that I experienced anxiety. Some of it is, I think, might have been effects of the medication. I couldn't even walk down the steps. So I called my son and told him, I said, you have to come over here because I have to go downstairs. And I know he thought, well, just go downstairs. But I was actually afraid. I was actually afraid to walk down the steps. After I went down and came back up, fine. But I just had this anxiety. I went through a little bit of depression, and kind of had an emotional meltdown. But my faith in God is what has allowed me to get through and is getting me through this situation. So my prayer is that your faith will help guide you and lead you, even when it comes down to taking the vaccination. And I know that so many people are frightened to take the vaccination, and they're very apprehensive. And for the African-American community, it is understandable because of the history that's been there. Once again, I'm going to exercise my faith in getting this vaccination when I'm able to. At this point, I'm still not even allowed to get the vaccination. I would like to get it, but I'm not able to get it yet. So as soon as I am, I'm rolling up my sleeve, and I'm a person that hates shots, but I'm certainly going to roll up my sleeve and get that vaccination. It is a long process. even people that were back up in 2 weeks, they still have the cough. Some of them are still having a cough a month afterwards. So there's many symptoms that you can develop after having COVID.
Thank you. Here's a question while we have you on the screen that might work well for a city council member and maybe for Mr. Martynuska as well. This is from Facebook Live. Is there a way we can bring vaccinations to the residents of places like Prospect, Oak Ridge,
Yes.
Coopersdale, Solomon? Yeah, all right, go ahead. You're on it. Go ahead.
Yes, and I know Art can jump in right after this because this is something that we discussed on the COVID task force, and I personally, this is my personal reason for getting involved with that COVID task force, is that we need to have as many vaccination clinics in the city of Johnstown as possible. If we want to see the residents of Johnstown get vaccinated, then we have to bring it to them, and taking it to the various housing communities is certainly a way to be able to ensure that those persons have access to the vaccination. I'm going to leave it up to Art now. I probably just threw you under the bus, but okay.
No, quite all right. And you encapsulated it very well. We can get that vaccine to the folks. We can set up mobile sites if we need to. And as I mentioned earlier, we're working with Camtran on developing a process where we can roll it out to the neighborhoods and even go door to door if that would be necessary.
Great to hear that. Here's another question from Facebook Live, and I think it's directly for Pam, but it might also involve Art as well. Has the pandemic created any thought of commissioners creating more county or regional departments of health? I know I work a lot with West Virginia, and they've got county departments of health, mixed results. What's going on in Somerset County? What are your thoughts about that?
Well, that has been discussed, and I would also ask if Representative Rigby could be brought into this conversation as well, because it's a matter of resources. And honestly, we are prepared for many, many types of emergencies, thanks to the Department of Homeland Security and our wonderful PEMA and emergency management agencies. But I got to tell you, we were not prepared for a major public health crisis. We've got some laws and legislation that were last updated in the 1950s when it comes to dealing with public health. The public health system has basically been the victim of funding cuts over the years at the state level. And of course, that trickles down to the local level. And so to look at this problem as a whole, and how we can prevent this in the future, or at least respond to it in perhaps a more efficient manner, because I think everybody has done the best they possibly could given the circumstances that we've had. We need to have that discussion. If that is the trajectory that we want to head, to be prepared for public health crises, we need to figure out how to fund that, whether it be at the regional level. Maybe every county doesn't need a public health department, but maybe there is a way in combination with both the state and federal levels, we can look at funding that system.
I think it's important, Pamela. Most people don't know. I mean, it's been overload for our health department, the state's health department. And while there's 67 counties in the Commonwealth, there are only 6 health departments within Pennsylvania. So, our Department of Health has really taken a beating. There's 61 out there that don't have anybody. And we get the calls in our offices and want to know what the county's doing and what the city's doing. And what they don't understand is they're falling under the direction of the Department of Health in Harrisburg. They don't have, each of these entities don't have their own health department and directors. Again, there's 6 in the Commonwealth. So, it creates a burden and a problem. And you're right. It certainly needs to be addressed, whether we do multiple counties, but put it into regions or however we address it. And I'm sure those talks will be forthcoming.
Thank you, Representative Rigby. We'll remind the audience, we do have time for some more questions. If you want to pose any questions on Facebook Live or through the Zoom Q&A, we do have a couple here that we can get answers to right now. And for this one, it was kind of aimed at everybody. But we'll start with Representative Rigby, and then we'll go from there. This was a question for all panelists. What is the most important lesson you personally learned from the COVID-19 pandemic? What on a personal level have you learned?
Chip, I shared my story. I think Reverend King hit it on the head that it's not a hoax, and people need to understand that. In our family, used to be we could talk about cancer and everybody knew somebody who knew somebody or knows somebody. And who would have ever thought we would now be putting that next to COVID that says, yes, we know somebody that was affected by it or somebody who has passed due to COVID. My mother-in-law in a nursing home. And we get a call in December on a Saturday that she's been diagnosed. I take my wife to the nursing home. Fortunately, my brother-in-law is a nurse practitioner, was able to gown up and go inside with her, cracks the window open, and we stand outside, and talk through the screen. That was on a Wednesday. Saturday morning, we got the call that she had passed. So, you talk about real time, 1 week's time, from the time we're notified to the time she passes. And this is just one of many, many stories that are out there. And so when people say it's a hoax and it's not going to be me, believe me, it is touching every person and every family. And people need to be, look, I said before, there comes a responsibility. We all have a responsibility. As much as they don't like the mask, put the damn mask on, personal responsibilities. And I think that, along with this vaccine, is going to get us to where we need to be. So that's just my 2 cents, right or wrong. Chip, I know you too dealt with it. So I'll put it back to you to go ahead and put it out to whoever you want to also address it.
Yes, absolutely. Representative, my family's been touched as well. Does anybody else want to take on that question? A lesson you learned from COVID-19, from the pandemic?
I'll say, I'm sorry, go ahead, Pam.
No, go ahead. Yeah.
I was just going to pose the question to the public. And the question is, am I my brother's keeper? And the answer is yes. As Representative Rigby said, there is a personal responsibility that comes with COVID. And as people of the world, I won't say just Americans, because this has affected the entire world. We are responsible for one another. We cannot just live in a bubble and live selfishly and feel that we can just do whatever we want to do just because you don't want to wear the mask, and nobody wants to wear the mask. It's not like people like wearing the mask, but not only does it protect me, it protects you. So for the sake of humankind, do the right thing, regardless of whether you think it works or not, because I've heard so many people say, well, it's worthless, it doesn't work. To some degree, it does work, so do what's best for humankind. Be your brother's keeper and wear the mask.
Thank you. Pam, you wanted to offer something?
I can't say it any better, but what I was going to say is I guess I've learned, truly day by day, the power of partnership over partisanship. We live in very partisan times, and this whole pandemic really can only be resolved if we all get out of our respective corners, work together. And I think we owe it to our constituents to take a look back, definitely give ourselves credit for what we have done correctly, but also to hold up that mirror and say, what could we have done better so that we cannot repeat those mistakes again? We lost valuable time and hours of misspent energy arguing over things that never made a difference and took away from all of those things that Reverend King just mentioned. We owe it to one another to do that, and to our constituents.
Thanks. Art, you want to tackle that question?
Certainly, and I'll just echo what everybody has said so far. It's a big universe but a small world, and just by looking at this panel, how we've all gelled and come together, and we've all had losses. And Representative, your mother-in-law, obviously I knew her very well, and my sympathies to everybody who's had losses in this. But if I've gained anything from this experience, is the importance of planning. We've always had pandemic plans. We've always had those documents ready and ready to go. And this shows the importance of those, but it also shows that we need to be prepared for the unexpected, because even the best plans in the world wouldn't have tackled what we're seeing now. But the bipartisanship that we're seeing is working very well. And kudos to all of our elected officials for the support that they have given those of us on the front lines to be able to do this. So preparation, preparation, preparation.
Great answers to that important question from everybody. Let's stay with Art Martynuska just for this question. We've got a very long question on the Q&A, and I'm going to try to summarize it. It comes from somebody who's having a lot of frustration getting vaccinated. A lot of hours on websites, on phone calls. Doesn't seem to be getting calls or emails back, and just clearly getting frustrated with the process of trying to get signed up, even though their family members are in the 1A group and should have been on a list by now. I'm not sure that we have the exact person on this panel to answer that question, but I know Art, your group is trying to bridge that gap and help people get the service that they need.
Certainly, and obviously that level of frustration is felt by many folks because of the lack of vaccine. It's not the lack of wanting, but the lack of. What I would encourage them to do is they have my contact number. They want to reach out to our offices tomorrow between 8 and 4, and we'll see what we can do to help steer them in another direction.
Representative Rigby, I'm sure you're getting the same calls at your office. I mean, what are you telling people, and how are you trying to get them connected with the services they're asking for?
We are relying on the communications we're getting from the hospitals, and as they're rolling these vaccinations out. But, you know, an important thing to remember, as we're finding out when we're speaking with, especially the elderly, there's a lot of people in this area that don't have, you know, we initially take the call and we say, well, here you can go to the state's website, you can link here and go right to there. And they go, but I don't have a computer, or I don't have internet access. We don't have that. And so, you know, again, we talk about how we can do things better in this day and age. I mean, we're just so used to going to the computer and finding and doing what we need to do. And there's still so many, especially the elderly, that don't utilize a computer, don't have the internet, or in our rural areas, they don't have that service. So that's, you know, with us trying to walk them through or try to make the calls for them or provide them with the numbers and the contacts they need to do without having to send them to the internet to find it on the state site. My staff has done an amazing job. I can't say more than what I can for my staff. They're an amazing crew here. And we deal with a lot of, they've become Department of Health, they've become unemployment compensation experts. They've handled a vast array of things that have come up because of COVID. And, you know, we've always got to step back and look at the shoes that somebody else is walking in and realize, you know, we get people calling here, we're trying to get them vaccinated. We're trying to get this other person their money from 8 months ago. And you wonder how they're going to, you know, they're not even worried about paying their rent. They're just worried about feeding their family. So, you know, these issues are real and they're out there, and we deal with them, all of us as elected officials deal with them on a daily basis.
If I might, if we have any seniors in Somerset County that are having the issue that Representative Rigby just mentioned, they're not connected to the internet, they don't have anyone who can help them, give the Area Agency on Aging a call at 443-2661, and we will have somebody help walk through the process with them. Once again, you know, 443-2661, and somebody will assist, or call your commissioner's offices as well. Our number here at the commissioner's office here in Somerset County is 445-1400. And Art, I don't know the Cambria County Commissioner's number, but I'm sure you do.
Art, do you want to provide? I mean, it looks like we're posting a lot of good information, and all the panelists have provided good information. Art, anything you wanted to add to that in terms of where people should go for their information?
If they just call our offices directly, we can route them to the office, appropriate department, the Office of Aging, or to whatever department may be necessary. We
did have a call or a question come in on the Q&A about having trouble getting through to the Connemon number that we put up. And I know we've reported that number is staffed 9 to 5 during the day. So if you're calling at night, you're probably not going to get a human being picking up that phone number. I would recommend folks try again tomorrow. Again, thanks to everybody who's been on. I think we're just about out of time. We do plan to be back on in 2 weeks. I believe it maybe a little later, April 6th, it looks like. We're going to get another forum together, and we're going to talk about the economic impact of coronavirus in our local communities and have a panel on to talk about what they're seeing and what's being done to try to help us get through this together economically. We'll open it up to the panel one last time. For anything you want to say in closing, it's been a great session. Representative Rigby, anything you would like to add?
I would just like to thank you and thank the panel that participated. There's a lot of good information going out there that it's hard to get this information out too. So putting a forum together like this where it can be shared really helps us get our message out to those that. Thank you.
Absolutely. Pam Tokar-Ickes, anything you'd like to say in closing?
Yes, I gave you the wrong phone number, 443, not 442-2661. Sorry, too many numbers in my life. 443.
Good to get that right.
Yes.
Art, anything from Cambria County?
Just encouraging everybody to still observe the safety precautions that are in place. And if they need any assistance, give us a call.
Excellent. And Sylvia King, we appreciate your courage coming on and sharing your story with all of us and with all the folks watching at home or on Facebook Live or through the Zoom. Anything you'd like to say about, what's happening in the city of Johnstown?
Well, there's certainly a lot happening in the city of Johnstown, and the more people that get the vaccine certainly will help be able to move things forward just a little bit more. So we're hoping that through working with the COVID task force that we will be able to open up some vaccine clinics here in the city. You can call the free medical clinic. Rosalie will definitely take care of you. I'm sorry I don't have the number, but perhaps either Ashley or Jill may have the number to the free medical clinic that they can put it up, because they certainly are a vaccine site. And as far as Conemaugh goes, I know that it is very frustrating, but that's the process. If you're calling, you just have to keep trying. And unfortunately, that's the answer, that you just have to keep trying. And once more sites open, I think some of that will go away. But for right now, that's what we have to work with. We're doing our best to make that available to each and every person that would like to be vaccinated. And I just pray that everyone, if you are on the fence, if you're leery about getting the vaccine, just continue to educate yourself, continue to listen and learn, and talk to people like myself who are still dealing with COVID. And I think that we'll be the ones to tell you we would have been the first in line to take the vaccine, and just have personal responsibility to one another.
Excellent. Let me correct something I said a few minutes ago. There are 2 sessions scheduled for future forums. March 23rd will be the economic session, and then April 6th we'll be talking about impact on education. So those are 2 important forums coming up. This one was fantastic. Thank you very much to all of our guests, Senator Casey, who was here for a while, and then the rest, Representative Rigby, Cambria County Emergency Management Coordinator Art Martynuska, Somerset County Commissioner Pamela Tokar-Ickes, and Johnstown City Councilwoman Sylvia King. Thank you all very much. Again,
Yep.
Thank you to This Together Cambria and the University of Pittsburgh at Johnstown for co-sponsoring this session along with the Tribune-Democrat. Thank you everybody who tuned in. Please stay safe. Take care.